Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Pharmacy Medicine, and today we will discuss about stab wounds. These are the wounds caused by sharp weapons. Stab wounds are deep wounds produced when the force is delivered along the axis by the pointed end of weapon or an object entering the body. So these are the wounds caused when the weapon enters along the axis of the body, and they are deeper in nature. This injury is generally caused by sharp pointed piercing stabbing weapons like knives, daggers, bayonets, arrows, pickaxe, broken glasses, spaces, and when they enter along the axis, cause the stab wounds. These stab wounds may be puncture wounds, penetrating wounds, or perforating wounds. Puncture wounds, these are the injuries when it just enters the part of the body without entering into any body cavity. So this only enters the skin, subcutaneous tissue, and muscle layer up to muscle layer, and they doesn't enter in body cavity. Those are called as punctured wounds. Penetrating wounds are the wounds weapons enter the body cavity, producing only one wound, that is the wound of entry, like knife entering the abdominal cavity without coming out of the abdomen, are the penetrating wounds. So major body cavities are like chest, abdomen, skull, are the in different body cavities where the penetrating wounds may be caused. So in this image you can see the weapon enters the body cavity and the puncture wound just enters the skin, tissue, and muscle layer. Other body cavities like which also can be quantified as penetrating wounds are eyeballs, major joints and knee joints, hip joint, shoulder joint also comes under penetrating wounds, which where the weapon enters the body cavity. Perforating wounds are through and through wounds, through and through puncture wounds, where weapon entering into the one side of the body comes out through the other side. This produces two wound, that is wound of entry and wound of exit. Wound of entry are through which the weapons enter the body. This causes the injury to be inverted. So if the body enters the skin, it is usually larger and edges are inverted. So you can see that injuries become inverted. And when this weapon comes out through which the weapon emerges out of the body, it usually is smaller and everted. So when the weapon comes out of the body, they are smaller in nature and their edges are everted. So their edges are everted and usually they are smaller compared to weapon because only tip comes out of the weapon. In this image, you can see that it is a wound of entry and wound of exit caused by the tip of the weapon, that is through and through wound. Now, different variant of stab wound is the incised stab wound. Stabs are incised wound where the ends at the stab they start as an incised wound and ends as a stab wound when there is a sudden thrust at the termination of incised wound. So, sharp weapon when start as an incised wound, sometimes it may be thrust open and it may become a stab wound, or it may begin as a stab wound and afterwards when weapon has been pulled out of the body, it may be dragged, causing the incised wound. Dacity stab wounds. These are entry wounds is slit-like or oval-shaped or round with irregular margins. So these are stab wounds which doesn't has a slit-like and edges are irregular and doesn't correspond to weapon. These are called lacerated stab wounds. According to weapon, there may be margins may also be bruised. Concealed wounds. So concealed wounds are special type of wounds caused in the concealed parts of the body. These are the punctured wounds produced by the needles, nails, or pins seen in concealed parts of the body like nostrils, frontal areas in case of children's, fornix of upper eyelids, axilla, vagina, rectum, and nape of the neck. These are caused by slender instruments such as ice picks or knives or thin blades. These puncture wounds can also cause fatal penetration injuries and without leaving any visible marks. So, like example, from nostrils, injury may cause brain damage. Brain may be injured, or hemorrhage. There may be cause hemorrhage by injuring the arteries, major arteries. Seen in cases of some homicides, usually done to conceal presence, like nostrils may be used, or case of eyes can be used, or sometimes rectum can be used to cause the injury in the body cavity and injury in major vessels. So these injuries are usually missed because they are concealed part of the body. They are present in the concealed part. Usually they are missed. Coming to characteristics of stab wounds, margins are usually clean cut because they are caused by sharp weapons. Sometimes if the weapon has a hilt, like in a knife there is maybe hilt guard or guard may be present. So this hilt guard may cause a pattern abrasion or bruising may be present. Usually the margins are regular, sharp and well defined. However, injuries caused by pointed or conical instruments may cause lacerated edges also. Length is usually slightly less than the width of the weapon. So length, it doesn't correspond to weapon, but it is slightly less than the weapon. For measuring the length, stab wound edges should be approximated. Now, breadth is more than the thickness of the blade. So breadth of the injury doesn't correspond to the weapon, and usually the skin has to be approximated both sides to measure the breadth of the injury. Depth is the greatest dimension of any stab wound. Depth corresponds to the length of the blade of the weapon entering the body when the whole of the weapon enters. If the whole weapon enters, then the depth corresponds to the weapon depth of the weapon. So if the person is alive, depth should be determined only in case of operation theaters, because sometimes if you measure the depth by using any glass rod, it may remove the clots and the person may go to hemorrhagic shock. In autopsy cases, you can use any glass rod or any blunt objects to measure depth of the wound. Depth of the wound depends upon different conditions, like condition of knife. It is sharp. If the weapon is sharp, then the depth will be more. If the weapon is blunt, the depth will be less. Resistance to offered by the tissues. If the tissues is soft, if like tissues is soft, it like face, or if it is a hard muscular layer like chest regions, if the ribs are present, then the depth will be less. Clothing, if clothing thickness is present, then depth will be less. If it is single layer of cloth is there, then depth will be more. Force applied is directly proportional. If less force is applied, less depth will be present. If force is more, then depth will be more. Location of where the body is present. If there is any bone is present underlying, then depth will be less. Angle with the strike. If it is along the axis of the body, then depth will be more. If it is away from the body or it is in the angle, then the depth will be less. Direction. When a knife penetrates at the angle, the wounds will be bevel margin. So sometimes the stab may not enter directly perpendicular to the body. It may enter at the angle, creating the underlying margins. So on one side there is undermining or undercut of the body. So it is undercut is the overlapping flap will be present on the other, so that the subsequent tissue will be visible. If it is seen, subsequent tissue will be seen here, indicating the direction of the weapon. So undermining wound tells the direction of weapons. In solid organs like liver, the track may be visible, clearly seen, because it is an intact organ. The track of the injury will be clearly seen. Now, shape of the injury. It is usually slit shaped with two acute angles or gape depending upon their location and orientation with regard to cleavage lines of Langer. So usually they are oval shaped with two pointed edges will be present, but they're depending on the location and the orientation, based on the cleavage line of Langer, their gaping will depend on that. So cleavage line of Langer, based on that, if it is along the cleavage line of Langer, then the gaping will be less. If it is perpendicular to cleavage line of Langer, then the gaping will be more because of the stretching of the skin. So stab wound which runs parallel to the cleavage lines, as in seen in this image, will remain slit shaped and narrow, and dimensions of the blade will represent the considered accuracy. So dimension will be accurate to that of the weapon. But if the stab wound enters through the cleavage lines transversely, then the wound will be gaped, and it will stretch beyond the skin tissue, and it may tear the skin also. Shape of the single depends on the different weapons. If it is single edge weapon, example, if the weapon one edge of the knife is sharp, then the surface wound will be triangular or wedge shaped, as is seen in this image. At one angle of the wound will be sharp, other end will be blunt or squared off. So this edge is pointed is the sharp edge, and this is the blunt edge of the weapon. Blunt of the weapon wound may have small splits of the skin, so-called fish tailing. So because this edge is blunt, sometimes the tissue will have some small splits called as fish tailing. Sometimes blunt edge of the weapon may split the skin and resemble double-edged weapon also. So in case of double-edged, usually it is oval shaped, and even in single shape, sometimes blunt edge may also cause splitting of the skin, leading to the double-edged weapon, looking like a double-edged weapon. Double-edged weapon, the wound will be elliptical or slit-like, and both angles will be sharp. So it will be elliptical, and both edges will be pointed or sharp will be present. Both pointed edges will be seen on both ends. A round object like a spear may produce a circular wound. Round object will produce a circular wound. A pointed square weapon may produce a cross-shaped injury. So sometimes if the weapon is square-shaped, it may produce a square-shaped cross-shaped injury, each of the four edges tearing the way through the tissues. So it may cause a stellate-like shape of injury because each edge may tear the skin differently. It may cause different shape. Stab produced by broken bottle may cause cluster of wounds of different size, shapes, and depth. So multiple stab wounds may be produced if the glass pieces are used. A screwdriver will produce slit-like stab wound, as in seen in this image. A skin wound produced by closed scissors may produce a flat Z-shaped wound. Ice pick will produce small, round, a slit-like weapon, slit-like injury, which may look like a .22 caliber bullets or shotgun pellets. A fork will produce 2 or 3 wounds depending on the number of prongs or pressures. Number of prongs, it may produce number of 2 to 3 puncture wounds will be produced. Different shapes are produced by different type of weapon. Complication of stab wounds. There may be severe hemorrhage and person may die because of hypothermic shock. There may be air embolism or it may be systemic or pulmonary embolism may lead. There may be injury to vital organs like heart, lungs, liver, or kidney. If the person survives, there may be secondary infections. There may be pneumothorax if the person survives, and there may be sometimes infection to the chest organ. So these are the few complications of stab injuries. Coming to medical importance, shape of the weapon may indicate the type of a weapon, like single edge may produce wedge shaped, double edge may produce oval shape. Depth of the wound will indicate the force of penetration, how much force it is used. Direction and dimension of the wound may indicate the relative position of the body, relative position of the person who has died, relative position of the assailant and the victim. Age of the injuries can be determined approximately. If the broken fragment of weapon is found inside the body, it will identify the weapon and it will connect the accused person with the crime. Position, number, and direction may may indicate whether the injury is suicide, accidental, or homicide. In case of suicide, following points will be helpful. Usually, they are present in the accessible parts of the body, like pericardial region, most commonly seen in the heart or can be present. There may be hesitation wounds may be present, that is, concomitant shallow stabs with similar direction may be present. So, multiple stab wounds may be present with accompanied by one major wounds. Direction, usually they are descending backwards and to the right side. There may be combination of trial cuts, mostly at the arms and wrist. Different insides will be present in the arms. Depth will be variable, mostly superficial, and one enters the heart or pericardium. It may be seen exposed or under dressing of stab regions. Extensive traces of blood on the hands of victim will be present. There may be severe bleeding will be present in the stab in the victim's hand. Defense injuries will be present. So defense injury which are caused by when person try to defend himself will be absent. Homicidal stab wounds. These are most deaths are caused by homicide. Stab wounds are causes homicidal, especially found in inaccessible areas such as backside. Stabs are most often located in the thorax or neck. Stab wounds of chest may have any direction, but the most common is direction the angle from the left to right from above downwards. Absence of weapon at the scene of indicate the suggest the stabbing is of homicidal nature. Number of stabs shows the correlation with the gender of perpetrator. Mainly, if the person male assailant is a male, there will be multiple wounds compared to if the assailant is a female. Accidental stab wound is rare, mainly seen because the person may fall against any projecting sharp objects like any glass or nails or iron rods. In case of accidental in construction areas, if the person falls on the pointed iron rods. These are my references. Thank you.